According to arthritis.org, osteoarthritis is one of the most common types of arthritis, affecting an estimated 21 million American adults. And it costs our healthcare system nearly $100 billion a year. Now, that's a lot of money. Now, there are a number of non-surgical options available for treating the pain and symptoms. And here to talk about multimodal treatment therapies is Dr. Susan Zito, a rheumatologist from Suncoast Internal Medicine. Susan, it's great to have you here on the show.
Thank you.
Now,
pleasure.
For myself and for probably a lot of people out there that don't know what osteoarthritis is, or OA of the knee, can you explain what that is?
Basically, the best way to think about it is a degenerative or wear and tear phenomena that takes place inside the knee joint. And basically, it involves the cartilage, which lines and cushions the ends of the bones that make up the joint, becomes worn away and loses its integrity. In addition to that, the joint fluid, which can compensate for some of that loss, also becomes thinned, and it loses its properties of cushioning and protecting and lubricating the joint.
Well, I maybe need some lubrication for my joints, because it seems like every time I bend down, my knees go crunch. So can you give us three main symptoms that we really need to look for if we might have osteoarthritis of the knee?
Absolutely. They call that crepitus, but more commonly what people will experience is pain, some swelling, perhaps tenderness, but also some loss of range of motion in the joint and stiffness.
I know there's many different things that can cause OA of the knee, but shockingly, I wasn't aware that 65% of women are more affected by this than men, and that's not fair.
No,
so give us some tips on how we can, prevent this.
The best chance at prevention is early detection. And employing multimodal therapy is one of a patient's best options. And that includes not only the difficult things like weight loss and exercise, but also over-the-counter non-steroidals and maybe even steroid injections from your doctor. But another option is hyaluronic acid therapy, which actually puts back in the substance that's depleted in osteoarthritis. And there are products that are made from hyaluronic acid, specifically Euflexa, which is a natural, non-avian injectable product that can be placed in the knee in your doctor's office, a series of 3 injections a week apart that can replenish that fluid.
That's fabulous. And I'm sure we're all a little bit different. We all have different symptoms and different results, that sort of thing.
Yes.
But I think we would all, especially myself, would prefer to go the non-surgical way.
Yes. If we can avoid taking a medicine that goes everywhere in our body for a problem that is localized, or even avoid an unnecessary surgery, that is fabulous.
All great points. Now, I know a lot of people out there are going to want to know where they can find out more information about OA of the knee, as well as Euflexa. Where can we go?
Easy. I would suggest euflexa.com. They have a wonderful website that details all of the signs and symptoms of knee arthritis, as well as some tips for finding a doctor where you can get this type of therapy, and for talking with them about the problem.
Thanks again. It was
My
great
pleasure.
having you here.